Yes, today we are very pleased to report our 2024 performance. So as you said, 10% sales growth, 20% profitability improvement, while we keep investing 12% of our sales in research and development. So basically the BioMérieux story, especially following the COVID period, has been to strengthen our portfolio of diagnostic solutions for infectious disease. And today's results show that we are delivering, as we planned, the launch of new solutions that help to treat better patients.
Can I ask you about the sector that you're in? It is such a fascinating place as we talk about one of the biggest healthcare challenges of our generation, and that is resistance to antibiotics. Now, what we've been hearing is too much overuse, too much prescription. What exactly is the threat to this medication that many of us have come to rely on if we do have a problem?
Yes, you're right to say that antimicrobial resistance is a big topic. It's actually considered by the WHO as one of the biggest threats for humanity in the years to come. There is close to 1.8 million people dying every day, one way or another related to antibiotics resistance. And in many countries, we're seeing an overuse of antibiotics. So there are many ways to fight against antimicrobial resistance, but one way is to better diagnose patients so that we can better differentiate between a viral infection and a bacterial infection. So of course, as we all know with COVID, no need for antibiotics when you have a viral infection. But when you have a bacterial infection, then you need to treat with antibiotics. And what we bring, BioMérieux, is the opportunity to make sure for the clinician that you treat with the right antibiotic at the right doses for the patient. So that's basically what we are doing to contribute to the fight against antibiotics resistance.
Pierre, if we go to the root cause of the problem, is it just overprescribing, overuse, or is it about antibiotics also in the food supply chain?
It's actually a combination of bacteria getting more and more resistant to the overuse of antibiotics. And the good news is when we see a rational use of antibiotics, actually the resistance to antibiotics gets lower. The other challenge that we're dealing with is the antibiotics reimbursement and coverage is pretty low. So it tends to push for overusing antibiotics and actually a very level of research for new antibiotics. So there are very few new classes of antibiotics. So what we're starting to see now is what we call superbugs that are resistant to every antibiotic that exists. Hence, the importance, the criticality of having good, very accurate diagnosis for bacteria.
I want to ask you about the United States because you have a very big presence there, and I can see it's roughly about half of your sales derived from the United States. There's a real rethink on policy approach there around health and wellness, thanks to John F. Kennedy Jr. Assuming that role that we're talking about in terms of health secretary. That's the direction the US is going in. He's been more focused on fentanyl and other drugs. What do you think is going to be the focus of the administration in terms of antibiotics and resistance? Do you think it's going to be something that they will focus on? And if so, what impact do you think that will have on your company?
Well, to be fair, Karen, there are new news coming every day from the new Trump administration. So this is something that we are monitoring on a daily basis. First of all, as you said, as a global leader in infectious disease diagnostics, we have a very strong presence in the US, close to 50% of our sales. For us at BioMérieux, we are kind of in a position fortunate where even though I have a strong French accent, we have 1/3 of our headcount based in the US, and we manufacture 85% of what we sell in the US. So the impact of tariffs is, I would say, moderate for us. With regards to healthcare policy, with the new Trump administration, really too early to say. But of course, we keep our eyes on the ball, and we'll try to make sure that as many patients as possible have access to good diagnosis solutions in that context of antibiotics resistance we're talking about.